Indeed, the here and now had come to mean everything to them. For there is no denying that the plague had gradually killed off in all of us the faculty not of love only but even of friendship. Love asks something of the future, and nothing was left us but a series of present moments. February 2020, it all begins. The virus sweeps away our habits, our certainties. In presence, lifelong learning, as conceived until then, is obscured. Health workers, on the front line, find themselves alone, defenseless, deprived of one of the most important resources, especially at that time.
The suspension of face-to-face learning due to the pandemic made us feel powerless regarding the need to provide timely knowledges and correct informations on the management of ongoing emergencies. I am a head nurse who was first asked in March 2020 to transform the geriatric ward I coordinate into a COVID ward. We had to carry out this transformation in 4 days. There were very dramatic moments when we felt more than ever the absence of training.
An important support is missing. Procedures change, tracks change, everything is reorganized according to the management of the pandemic. But which place does lifelong learning in dynamic of change?
The pandemic in the year 2020-2021 has created a major restriction on lifelong learning, especially for in-presence courses. All of us had to adapt to the possibility of lifelong learning and training, especially during the COVID period, through digital platforms. When the pandemic invaded and occupied the spaces designated for face-to-face training, it was necessary and inevitable to resort to e-learning. Consequently, e-learning, which still played a marginal role because it was considered not very suitable for lifelong learning in healthcare, became the only solution at that time to make up for the absence of classrooms, which had now become rooms for patients or support spaces for healthcare activities.
E-learning, through the use of multimedia technologies and the internet, facilitates access to resources and services, encouraging both remote sharing of information and collaboration. It seems to be the optimal solution to the problem. The impact has been significant because it has clearly forced all of us to change quickly the planning of events that we had already scheduled.
The initial training tools were created by the professional groups that at first had to deal with the pandemic.
On the other hand, however, it forced us, and I see this in a positive light, to reorganize many events. Perspectives had to be changed, training had to be transformed, and design had to take new paths. Those involved in the design and implementation of training activities had to face the change, training in e-skills.
I'd also tried to enter the digital world on my own, but I didn't have the right bases and tips. I didn't know, and I wasn't able to do what I imagined myself doing because I lacked the right tools and the right methods. The first company distance learning course actually came after the first pandemic peak.
Summer 2020, Marche Region is organizing, with the support of USA, a regional course, already scheduled in the 2019 and 2021 regional training plan on digital skills, that has been accelerated by the pandemic, and to respond to the need to provide tools, contents and practical methods to design, produce and independently manage training material for e-learning. A methodological and practical approach is given, to support participants in understanding the methods and tools of blended design, in order to standardize the knowledge and languages of all the resources involved, in the different phases of the design, production and implementation of lifelong learning activities.
The very practical nature of the training course allowed us to get to know these new tools for implementation of lifelong learning activities. And we found ourselves in a group that has become increasingly passionate and involved in following this course from home in the midst of smart working period, with a mad acceleration towards this new world of words, almost all in English. And so we had no choice but to learn quickly.
The masterclass is divided into 5 modules, and addressed to a total of about 35 employees, from all the regional health service entities. The aim of the course is to support instructors and internal designers in the design and production of effective e-learning and blended materials courses, so that they can proceed independently.
But once the training course was over, I asked myself, what now? It is one thing to have known, but another to put into practice what you have learned. It is not so easy to be able to create a lifelong learning program. So what happened? Academy was born.
The first thing I thought about this project was the difficulties that would arise in doing my job, which is purely graphic. Finding a model that holds the learner's interest is not an easy thing, especially when the contents are articulated and complex. In February 2021, the Marche region establishes and formalizes with a specific decree, Academy Marche, a regional working group for the design, distribution and monitoring of e-learning and blended at distance courses for staff of the regional health service.
Marche Academy is a physical and virtual place, where the focus is on the learner as an active subject, for the development of competencies and skills, also through the use of new digital technologies. The Academy experience is a winning one because it allows fusing all our previous and acquired skills to offer excellent lifelong learning courses to our colleagues.
The Academy works to design courses of shared regional interest, with subdivision of subgroups by content.
To this has been added the Academy experience, consolidating and strengthening in a stimulating environment the application of digital tools to the design of training activities. Academy makes us feel still participants in the course. So we manage to go deeper, do exercises and be stimulated.
Academy monitors the digital activities carried out by the entities of the Regional Health Service, prepares proposals for the design of communication content, for the dissemination of digital culture and the continuous enhancement of professionalism, promotes the development of digital skills.
Now I feel as if I have that extra something that I miss to understand how to change my way of thinking.
In September 2021, the Marche region and the Regional Health Agency conclude the administrative process and acquire a single platform for the distribution of blended and e-learning courses, delivered by the region and all the regional health service entities, which is presented to the professionals and the entities' directorates. Another training starts, which is on the skills to use Moodle LMS platforms. From April 2021, the design of first course has been started, trying to make an innovative use of the available digital tools. In the design process, the Academy members worked closely with content experts and safety managers from health and hospital companies. The course on worker safety is constructed using this vision. A more functional solution could have been the involvement of the subject beyond the screen through interactivity. Gaming, emotional videos, podcasts and animations, combined with graphic images, make an on-screen training course more pleasant to follow. Videos with emotional impact that create strong involvement, like a teaser. Scenarios with virtual speakers for simulations. Graphically elaborated slides with interactive sound. Exercises through gaming. Summary podcasts.
The experience made us understand how essential it is in emergency situations, but it also made us see the advantages of this training methodology that we should definitely consider in the future, even if I would say integrated with traditional training methodologies.
The third learning level is for all those who see learning and change as an indissoluble link, an inseparable unity, and for this reason they train themselves, not to learn for change but to learn from and in change.